In this chapter, we will explore the risk management process. Once completed with this module, you should be able to identify risk management components, explain the need for effective risk management concepts in an EMS agency, examine the history and development of risk management, evaluate methods of risk management, identify the roles and responsibilities of leaders in risk management, identify the role of EMS personnel in risk management, and describe the benefits of risk management. To begin this discussion, consider this scenario. You have a committee at your ambulance service looking at new equipment and procedures. The committee has recently started exploring the thought of providing transport services for high-risk neonatal patients. Not only are these transports inherently challenging, but a variety of special equipment must be purchased in order to provide these services. You have been asked to perform a risk assessment to assess the risk your organization will shoulder in providing such services. While you are more than willing to help out, this is not necessarily your area of expertise, and you have no idea where to begin. Management has asked for you to report on your findings within 2 weeks. The first obvious question is, where should you begin? What would the prioritization formula look like for this issue? What would be your final recommendation? Hopefully, this module will provide the foundation for you to begin working through such questions if asked to perform a similar risk analysis within your own organization. At the onset, it is important to recognize that risk management is a team effort. From the chief or CEO all the way down to the newest member or volunteer in the organization, everyone plays a part in risk management activities. This chapter establishes a process that can manage the risk based on the EMS Risk Management Resource Guide developed by the Pennsylvania Emergency Health Services Council and funded under a contract with the Pennsylvania Department of Health. At the start of this discussion, it is important to define both risk assessment and risk management. Risk assessment is the process of identifying risks and associating a relative value to each risk. This is done by determining the probability that a bad event may occur, the detrimental or undesirable consequences related to such a bad event, and the severity of the potential harm resulting from the event. By factoring these elements into a risk assessment, a risk manager can begin to weigh one activity against another and set priorities for minimizing risk within the organization. Risk management is what happens after a risk assessment is conducted. Managing risk consists of comparing or evaluating risks and developing methods that will affect change in the probability or consequence of an act. Driving an ambulance, for instance, is an unavoidable risk. To manage that risk, however, a service may utilize priority dispatch to respond with lights and sirens only when warranted. Providing driver training or approving drivers with relatively clean driving records may also be used to manage risk. Risk management can occur at different levels within the organization or with different target populations in mind. Community risk management, for instance, is a function of EMS as part of the public health system whereby EMS organizations work within the community to proactively prevent illnesses and injuries within the general populace served by the agency. Such activities are different in scope than those taken to address risks within the EMS organization itself. Similar to an organizational safety officer, the primary risk manager within an EMS organization may wear several hats, yet that does not diminish the importance of the individual's risk management functions. For risk management activities to be effective and sustainable, the risk manager, and the organization for that matter, should utilize a risk management system and ensure the goals and objectives of the system are clearly stated, understood by everyone, attainable, and measurable. When defining goals and objectives for a risk management system, keep in mind that the goals are the benchmarks that are established to affect certain outcomes, while objectives are the means by which a goal is obtained. Identification and evaluation of risks, as well as the identification, selection, and implementation of control measures, make up the complete process of risk management. These principles apply to risk management activities regardless of whether they are internal to your organization or are used as part of a community outreach program. From a simplistic standpoint, there are 5 steps in the risk management process. Identify the risk potential, prioritize the risk, determine and implement controls, and evaluate and revise as necessary. Identifying and analyzing loss exposures means detecting potential sources of loss. There are numerous sources of exposure to risk within EMS, so it is often recommended to utilize documentation that already exists to identify for loss exposures. Such documentation could include injury reports, accident reports, disciplinary actions, or other action-type reports. Do not hesitate to seek additional resources from other EMS organizations, industry or trade journals, or your own insurance carrier to assist in loss exposure identification. Evaluating the feasibility of alternative risk management techniques includes principles of exposure avoidance, loss prevention, separation of loss exposures, duplication, insurance, and retention. These principles will be discussed in just a little bit. Once alternative risk management techniques are evaluated, it is necessary to pick the best techniques for managing the identified risk, implement those techniques, and then be sure to monitor the intervention for effectiveness. Implementing an intervention without performing follow-up can be just as bad as not making changes in the first place, depending on the circumstances. Follow-up is critical in effective risk management activities. A number of areas must be considered when examining the feasibility of alternative risk management techniques, such as exposure avoidance, loss prevention, separation of loss exposures, duplication, insurance, and retention. Exposure avoidance is simply deciding to not do something that has inherent risk associated with it. If I'm worried about my parachute not opening, I can avoid that potential risk by not going skydiving in the first place. It may seem like common sense, but exposure avoidance is easy to miss as a risk management technique if the activity is ingrained within the organizational culture. Loss prevention techniques attempt to mitigate potential risk exposure through equivalent policies, procedures, or practices. Obtaining a patent airway through intubation can be risky. To minimize that risk, services can also ensure providers have other non-visualized airways available for use with protocols for terminating intubation activities in favor of using an alternative airway. Not worrying about maintaining airway due to the risk involved is not an option, so a service must look for ways to minimize the risk through loss prevention initiatives. Similar to making sure the president and vice president are not in the same place at the same time in the event of a disaster or other catastrophe, EMS services may also attempt to physically separate loss exposures. As an example, an EMS agency may remove its ambulances from the station and park or drive them in different locations in the event of severe weather, just in case the station suffers significant damage from something like a tornado. The loss of a station can be catastrophic to a service if all assets are in the station when it is destroyed. Having those assets in multiple locations helps minimize the impact of such a loss. Backing up computer data is another example of how it is possible to separate loss exposures. A computer may be in one place and copy of the data is in another, thus insulating the entity from loss given the theft or loss of that computer. Duplication is another technique for minimizing risk. An ambulance service with a single ambulance will have trouble functioning if that one ambulance suffers a mechanical failure. To protect against that eventuality, many services have a reserve ambulance available in case their primary unit breaks down. This is an example of duplication as a risk management technique. Insurance also provides protection against risk by ensuring financial resources are available if a bad event does occur. This could include the totaling of an ambulance after a motor vehicle accident or the payment of money to the plaintiff in a successful medical malpractice lawsuit against the service. Insurance spreads the risk out among all policyholders, thus allowing the insured to have peace of mind while only paying a fraction of the costs associated with a catastrophic loss through periodic premium payments. In some contexts, retention of a risk does not sound like a risk management technique at all. Essentially, the agency simply does nothing about the risk. The risk is one the agency is willing to assume. This is akin to self-insuring against risk, assuming the risk is a financial one. In some cases, however, retention does make sense. An EMS service with an old reserve ambulance may choose to not insure the vehicle against loss due to the age of the vehicle, as the totality of premiums paid may be more than the vehicle is ultimately worth. That is not to say state law may not require insurance to be carried, at least for liability incurred for operating a vehicle on the road. The service simply is not seeking insurance coverage on the vehicle itself. There could also be instances where a risk is deemed to be so minor or out of the realm of possibility that any negative repercussions associated with the risk are simply not worth a great deal of concern. With all that being said, it is not unusual for an entity to employ multiple risk management techniques across the organization. To help visualize the way in which a risk management evaluation is performed, the textbook provides a risk management evaluation chart. This same type of chart is often used when determining how frequently to train within fire, EMS, and emergency services. Low frequency and low severity risks are not very high priorities for an organization. On the other hand, those risks with high severity and frequency must be addressed by the organization. Retention of a risk, as described earlier, may be okay for the low frequency, low severity risk, but it is probably not acceptable outside that single category as severity, frequency, or both increase. While there are different ways to select a risk management technique, many systems rely on some type of formula or process to assist decision makers. In the cost-benefit analysis model provided within the textbook, the author shows how factors associated with incident severity, probability, and exposure can be utilized to generate a number to provide a relative measure of overall risk. Table 5.3 within the textbook shows how incident severity is determined within this model. If there is no potential for damage or injury, variable S is equal to 0. On the other hand, if the severity of a potential incident is catastrophic with potential fatalities, a factor of 5 is associated with the risk's severity. The same analysis is then conducted with the risk's probability and exposure as included within the textbook in tables 5.4 and 5.5. With a value for severity, probability, and exposure generated from the aforementioned tables, the three can be multiplied to generate an overall risk score. Anything with a risk score of 0 requires no action whatsoever. Anything with a risk score of 80 to 100 is considered to be a very high level of risk, and any actions associated with that risk should be discontinued immediately. Values in between those two extremes can be used to guide action as well. Once it is determined that something must be done to mitigate or minimize a risk, it is time to implement the chosen intervention or interventions. Insurance is one such way to transfer and minimize risk for an organization. Not all risk exposures are insurable, however. Loss control for EMS is a rather new idea, although it is becoming more commonplace in our litigious society. An effective and proactive loss control program is essential for maintaining and improving a company's financial success, customer service by attracting and maintaining customers, management, personnel morale, and equipment serviceability. To be most effective, managers must model the behaviors and attitudes they expect in personnel. For those of us in EMS, loss control is somewhat similar to mitigation of an emergency. Once an emergency happens, it is too late to stop the emergency. Rather, it is now your job to mitigate that emergency and reduce potential negative impacts. Take a 911 call for a person having a heart attack. The heart attack already started, so there is nothing that can be done about that. The job of the EMS crew at that point is to do everything they can to minimize any further damage to cardiac muscle by providing care and treatment while rapidly transporting to a definitive care facility for further interventions. From a management perspective, loss control is the same premise. Once a loss occurs, the organization must take affirmative steps to control that loss and minimize the impact of that loss on further operations and the bottom line. Take an injured EMT, for instance. Restoring that EMT to working status as soon as possible is in the best interests of everyone involved. Lacking a process for restoring an injured EMT to work will be an unnecessary drain on the service and can also take a physical and emotional toll on the affected employee. When thinking about the relationship between loss control activities and insurance coverage, there can be hidden costs associated with losses that are not covered by insurance, such as lost work time due to an injury, hiring costs, overtime costs, clerical time, damage to equipment, and so on. Effective loss control activities will ideally minimize the impact of these hidden costs, which is beneficial considering such costs are typically not insurable. The previous chapter in the textbook dealt with safety programs, and it should come as no surprise that effective safety and prevention activities are integral in effective loss control programs. For a safety program to be effective, safety concerns must obviously be identified. One way in which to find these safety issues is to conduct a safety inspection. Whether a safety inspection is conducted informally by personnel, supervisors, or managers performing other job duties at the same time, or the inspection is a formally scheduled one, Such inspections are valuable for identifying safety concerns. The use of standard operating procedures can also help minimize risk by defining procedures for repetitive tasks that must be performed the same way every time, clarifying the steps in a critical task that must be performed by following detailed step-by-step instructions, and providing standardization to ensure quality control. It is important for everyone within the organization to have the ability to report safety concerns, and there must be a reporting policy in place that provides multiple avenues for the reporting of safety concerns. A safety committee, as described in Chapter 4, should also be utilized as an integral part of an effective safety and health program. There is no denying that EMS personnel work in high-risk areas. Following principles of effective risk management can help minimize exposure to those risks. While the WCTC EMS Leadership and Management Technical Diploma program has a standalone legal and political aspects course, we would be remiss to not discuss some of the legalities associated with safety and prevention activities. Simply stated, employers are legally responsible for workplace injuries and fatalities by virtue of workers' compensation laws. Workplace safety and health is also regulated by federal OSHA and state laws. What requirements apply will vary depending on the state in which the employment takes place and can vary depending on whether the employer is a governmental or non-governmental agency. Some states adopt NFPA standards within their laws, and even OSHA will recognize NFPA standards under its general duty clause if an NFPA standard is more restrictive than an OSHA provision related to the same subject matter. In the event of a lawsuit, NFPA standards can also be used to define an industry-wide standard of care or expectation. Beyond the risks faced by employees, EMS agencies also recognize the duties owed to the public at large as well as the individual patients they serve. Depending on the state and the employer's status as a governmental or non-governmental entity, potential liability for a breach of duty to the public or a patient can fluctuate significantly. Within Wisconsin, for instance, governmental entities enjoy civil liability caps of $50,000 unless the claim involves a volunteer fire department, which reduces the potential liability to $25,000. If the claim involves a motor vehicle, however, the cap is elevated to $250,000. Good Samaritan laws may also come into play if an EMS provider is not compensated or does not have a duty to the patient, depending on the state. The law also commonly recognizes something called the firefighter's rule, whereby an emergency worker, not just a firefighter, cannot sue someone for a negligently created hazard. Essentially, the firefighter, police officer, or EMS provider assumes the risk that comes with the job, and courts are hesitant to allow emergency workers' lawsuits to proceed against third parties out of fear that such lawsuits would undermine long-standing social policy. We want people to call 911 when they need help, regardless of how the perilous situation came to be. If someone who needs rescue can be sued by an injured emergency worker who is rendering aid, that could weigh on the decision for that person to call for help. While some states have begun to soften the impact of the firefighter's rule in egregious cases, such exceptions are typically narrowly defined. Going back to the scenario at the start of the chapter, you may want to conduct a cost-benefit analysis of the potential risk. First, if something bad happens on a high-risk neonate transport, death is a very probable outcome. In evaluating the severity of the risk, that earns the highest value of 5. The probability of something bad happening is a little more nebulous. While probability may sometimes have to be based upon a best guess, in this case, there is data showing that, under normal circumstances, there is a 50-50 likelihood of an incident occurring during one of these neonatal transports, resulting in a value of 3 for the incident probability. Lastly, you will need to look at the exposure to risk, which, after consulting with your insurance carrier, was determined to be above average, resulting in a value of 3. When you multiply these factors, 5, 3, and 3, the product is 45, which is considered a substantial risk. Given this substantial risk, it is important to recognize that initiating this service is not a decision to be taken lightly, and your EMS agency must seriously consider the value of providing this service compared to the potential risks associated with it. At this point, you should now be able to identify the 3 interrelated concepts that are used in determining risk, describe the typical responsibilities of a risk manager within an EMS organization, diagram the risk management process, identify different types of risk controls, define ideal characteristics of an insurable exposure, and cite several examples of hidden costs associated with losses.